Ross, Vice President with the Kaiser Permanente Institute for Health Policy, and I'm pleased to welcome you to this important event. Throughout the COVID-19 pandemic, frontline healthcare workers and public health officials have shown incredible strength, resilience, and compassion. On behalf of Kaiser Permanente, I want to thank each one of them, especially the honorees here with us today, for their service and their sacrifice. The COVID-19 pandemic forced all of us to adapt to new ways of working and living. At Kaiser Permanente, our healthcare teams pivoted in extraordinary ways to ensure the safety and health of our 12.5 million members. In 2020, these teams leveraged our integrated model to care for almost 600,000 patients with COVID-19, including delivering intensive hospital care to nearly 33,000 patients infected with the virus. They administered 4.8 million COVID-19 tests and provided over 120 million outpatient interactions digitally, which was over 80% of all outpatient touches. And in 2021, we've vaccinated over 10 million of our members. These achievements could have only occurred because of the dedication and strength of our frontline caregivers. I'm excited to hear more stories of resilience and learning from today's speakers as we look back on the challenges we've overcome and look forward to a healthier future.
Hello and welcome. I'm Sarah Dash, and today I am humbled and honored to introduce Voices from the Frontlines, a special program of the Alliance for Health Policy. I want to begin by thanking the sponsors, board members, and team members who made today's program possible. We could not have done it without you. Over the last 18 months, the Alliance has delivered nonpartisan programming on nearly every facet of the pandemic. In this unprecedented time, our audience urgently needed facts, honest dialogue, and a clear presentation of the issues. We did our best to bring you diverse voices from across the country to explain the emerging evidence, share real-life experiences, and guide the conversation. Amidst all these voices, there is one I'll remember most of all. On an early summer day in summer of 2020, the Black Coalition Against COVID, led by the Alliance's own board chair, Dr. Reed Tuckson, broadcasted a memorial service for those in Washington, D.C. who had already lost their lives to this deadly virus. And through the radio, I heard the voice of a child who was there with his sister. He shared stories of a loving father who gave hugs, made him laugh, and brought him courage. And the grief in his voice was heartbreaking as he mourned a father who was never coming home. My friends, we mourn the 763,000 Americans who have lost their lives to COVID-19, each of them precious to someone. And we cannot yet declare victory over a virus that is still claiming over 1,000 lives a day in our country alone. But we can remember what is at stake, and we can be grateful for the progress that has been made. So today, we at the Alliance are honored to recognize the people on the front lines who have shown up, rolled up their sleeves, and worked day and night to help us turn the corner and emerge stronger from this pandemic. Across public service, research and innovation, community engagement, public health, medicine, and communication, today's honorees used the tools they had and invented new ones, bringing their ingenuity, perseverance, and courage to the battle. They are ordinary people in extraordinary circumstances, and they exemplify the American spirit. And as they will tell you, none of them did it alone. Today, we'll hear firsthand about how new partnerships came together during pivotal moments. We'll hear about critical decision points, moments of doubt, and exciting breakthroughs. And we'll hear about lessons learned as we look towards the future. As I've gotten to know today's honorees, I've been inspired by their ethic of service, respect, and a shared commitment to defeating the virus and creating a path towards a healthier future. These honorees remind us that although our differences are real, so are our shared American values of life, liberty, and the pursuit of happiness. Values that can give us renewed strength for the road ahead. So on behalf of the Alliance for Health Policy, our team, and our board of directors, I invite you to enjoy Voices from the Frontlines. And now it is my sincere privilege to introduce Dr. Tanisha Carino, Alliance board member and an incredible health policy leader herself, to moderate today's first two sessions. Tanisha, welcome.
Thank you so much, Sarah, and thank you to the Alliance for hosting this event. I'm honored to be part of Voices from the Frontline and look forward to moderating the first two sessions today, to be able to personally thank and to celebrate our public servants and those that have been able to advance our science. A sudden devastating pandemic required that we had swift, national coordinated response and spurred those not only in public service, but also all across the ecosystem to action. I know each of us remembers that moment when we realized that this was not a drill. And in fact, I remember my sister-in-law asking me, knowing that I've spent my life in public health and in health policy, isn't this the Super Bowl that all of you all have been working towards all your careers? And it was. And secretly, I didn't know whether we were going to be prepared for it. And I'm happy to say that it looks like we have been. And I'm so grateful for all of the people that we're honoring today. So typically, our public servants have been behind the scenes. And with COVID-19, the attention was thrust on them to show us the way, to spotlight and help us as a nation move forward. So our honorees in the public service category led the charge to establish Operation Warp Speed, a public-private partnership designed to accelerate the development and the approval of the COVID-19 vaccines that we see today. It's my pleasure to introduce our honorees. First up is Dr. Peter Marks, who many of you already know. Dr. Marks is a hematologist and oncologist who served as the director of the Center for Biologics Evaluation and Research at the US FDA since 2016. As the director, Dr. Marks played a pivotal role in setting the foundation for Operation Warp Speed and has been spearheading the approval of the vaccines that we see today. Dr. Marks has previously spent time in the private sector as well as in academic medicine at Yale University. Recently, Dr. Marks became the acting director of the FDA's Office of Vaccine Research and Review, where he continues to oversee vaccine regulation. Dr. Matthew Hepburn is currently the senior advisor for pandemic preparedness in the White House's Office of Science and Technology Policy. He previously led vaccine development for Operation Warp Speed and its successor organization, the Countermeasure Acceleration Group. Prior to that, he served at the DoD, where he led DoD's Vaccine Acceleration Program, which was also pivotal to Operation Warp Speed. He served 23 years in the U.S. Army as an infectious disease physician, retiring as a colonel. In those last 6 years, he was the program lead at DARPA, making breakthrough investments that we see today as critical in our pandemic response. Thank you, Peter and Matt, for joining me today. So I'll start off with an opening question for both of you. Describe that moment when you guys realized this is not a drill. This really is the Super Bowl of our careers. How did it feel to know that your individual actions and the actions of your agencies would be pivotal in how we were going to weather through what was going to be a challenging period of time? Matt, would you like to start and then Peter follow on?
I'd be happy to. But to start, I mean, I am deeply honored just to be part of this, and certainly with my good friend Tanisha, but and with Peter, who is one of my heroes in public service as well, and certainly partner in the early days of Warp Speed as well, so which I fondly remember. But also just I really appreciated Sarah's initial comments about this being literally the efforts of thousands and thousands of people that made it possible for us to now have the vaccines and the therapeutics that we do. And I'm happy to be one of many, really, again, thousands of Department of Defense, active duty, National Guard, who have labored nights and weekends for 18 months now in this pandemic response. I think there was a lot of experts, friends and colleagues from my former, throughout my career. And we were just all talking to each other in January and even in December and saying, this really looks bad. And you never know. You can always look back and say, oh yeah, I knew. Well, you never really knew, but there was, all the warning signs were really there fairly early in the process. And I think there was a lot of agitation. There was a lot of, what are we going to do, and how are we going to move out? I think what was really, frankly, monumental, was when we were proceeding into March and April, and you had leaders like Peter said, you know, we can't just go through the motions of normal product development because this looks like a pretty serious outbreak. This is a once in a lifetime, and it's going to take a once in a lifetime effort, a monumental effort, led by the federal government, but with the private sector and foundation and partnerships all across the vaccine manufacturers and supply chains and distributions and administration, and all that went into vaccinating literally hundreds of millions of Americans. And that's when sort of the goosebump moment for me was really in that May timeframe, when they were saying, you know, hey, you're going to be assigned to Operation Warp Speed. And it was like, yes, this is exactly what now is the time. And my agitation and all of that uncomfortableness really just turned into purpose. And it was a pleasure to serve in that role. It was a pleasure to serve with if you will, a band of brothers, to sort of use an army analogy again, of all of us collectively to drive towards this.
Thanks, Matt. Peter.
Yeah, no, thanks. So first of all, thank you again. It is a true honor, and it is really wonderful to be here with Matt. This is it's some of the camaraderie that developed during this period that will last a lifetime. You know, for me, let me just say, I agree completely with Matt. Starting in January, it was starting to get this ominous feeling. And the ominous feeling continued for me into February. But I was actually sitting on a train, I think it may have been February 26th of 2020. And the reason, because I remember I was going to New York, and I think it was somewhere I was working on my laptop and looking at the epidemiology of the outbreak and getting down to the granularity of seeing that Italy was starting to look like a really big mess. And having worked in Europe, knowing that that's a disaster because the borders there are such that meant that the rest of Europe was going to be very much a big mess very shortly. And then looking around and realizing that we actually at that point had cases popping up then on 6 continents. And then it just realized that we're in a pandemic. And we're going to have to start to fundamentally change our battle plan for what we were doing. And I think that honestly, that was, when you think back to Warp Speed, that was, you know, Warp Speed wasn't any one thing that was like totally out there and crazy, but it was just basically changing the normal battle plan to one of having to do things to try to mitigate loss of life in a setting where you could see it coming. Yeah. So that was I think the insight there.
Let me ask the next question, Dr. Marks, to you first. Like, where did the name Operation Warp Speed come from?
Yeah, it came from the fact that in late March of 2020, we started to think about ways that we could speed up the regulatory portion of the vaccine work by doing real-time review of information as it came in, working closely with sponsors. And we gave that because it was something a little bit unusual, and because we needed a name to call it when we were talking about it, we gave it the name Project Warp Speed, maybe it's, I am not, contrary to what some people said, I am
You're
not a
the marketing
diehard
guru,
Trekkie,
huh?
but I did watch my fair share of Star Trek when I was a kid. And so we called it Project Warp Speed. And eventually, when the project needed a name, it just used it. As we moved into a larger, I mean, it morphed. It started as the regulatory portion. Then it moved into being how we could do vaccines more quickly. And then actually with Secretary Azar and Robert Cadillac, the Assistant Secretary for Preparedness and Response, who then even widened it further to diagnostics, therapeutics, and vaccines.
Matt, do you remember when you first heard the name Warp Speed?
Oh yeah. So yeah, and I was over at DOD, and they were like, this was, and one of the frankly, one of the best parts of Operation Warp Speed was that as a joint endeavor, and with all of the expertise that Health and Human Services brought. But I originally started as part of a team under General Gus Perna, 4-star, who was in charge of Army Material Command. So one of the, frankly, the best logisticians in the world, responsible on a daily basis for moving things all over the world effectively on time. And it was just, the main message is that government can work, and frankly, America can work. That you can take, when you have focus, when you have mission, when you have people. One of my favorite quotes from Warp Speed is "Check your ego at the door." I mean, it was team from the very beginning to when I left, a month ago, and that shows what our government can do. For everybody that doubts government, government can't work, I think we showed government can work and work together. But I think we also showed that America can work too. I think the idea of how the private sector comes in and works with the government, not in an adversarial relationship or some, but a truly cooperative relationship. It shows that Americans get out there and get stuff done. In every one of these meetings I talk about Warp Speed, I remind people of the literally thousands, over 100,000 volunteers that signed up for vaccine clinical trials so that we can understand if these worked or not. I mean, hundreds of thousands of volunteers in clinical trials. It's extraordinary. And I think it speaks to the American spirit. And it still does. I mean, right now, there are thousands of public health and pharmacists and healthcare workers that are doing shots in arms. And they're continuing to do that. And we're not done with this pandemic. But so for all of the awfulness of this pandemic, which has been so bad, that gives me hope. And frankly, makes me think, as we think about the future of pandemics, that anything's possible. If we truly are committed, if we truly put our minds to it, we can do so much more.
Thank you, Matt. And thank you for acknowledging also the role of those that volunteered to be part of the clinical trials, because it really was hundreds of thousands of people that help all of us have faith that this was something that we could all do. I appreciate that you two are such heroes, and you guys are part of families who are also navigating through what was a scary time for any family, and appreciate the role that your families had in supporting you all. Anybody faced with such a challenge, you don't know whether it's a sprint, you don't know whether it's a marathon, all of a sudden you're being told it's Operation Warp Speed, which just means does that mean I have to go even faster? So I'm sure there was a number of reactions to that. But was there ever a moment that you felt uncertain? Like, what were the most challenging parts of that journey for you? And what was the most surprising? One of you volunteer to go first.
Yeah, I'll say this. I think this may have to do with the fact that we had a really great group of people together. As far as the vaccines went, I had pretty good confidence that we would get through with one of the various iterations of the portfolio of vaccines that was put together. And I felt like having the collaboration between the Health and Human Services folks from CDC, FDA, NIH, and down at HHS, together with the DoD, because DoD has tremendous expertise in health, but the logistics support, also just some of the very practical thinking, rather than kind of up in the clouds, ivory tower thinking. It's just practical thinking. Well, you want to do that? How are you going to do it? Right. I actually felt I never lost confidence that we were going to get to a vaccine in a reasonably timely manner. And I think that the confidence came from having people that were working so well together, and that were navigating a lot of different obstacles. There were a host of different obstacles to navigate, but the mentality was, and it still is to this day, at least for me, we're going to get through today, leveraging what we have in our armamentarium to do something. And I just want to say this. I don't know exactly. I can only imagine what it must have felt coming out of long campaigns for battles with in the military. But what has happened is there is a certain efficiency from having essentially a crew that has worked together that is incredibly helpful, because what it does is, first of all, everyone understands everyone else's moves, but it also lets me as a leader know what we can actually accomplish reasonably, because you know what the limits of your team are. And I think that's the fact is the what was put together for Warp Speed was a team that really had, I won't say limitless, but it really had a very incredible potential to get stuff done.
Love it. And a mentality to get stuff done. How about you, Matt? The most challenging time, or something that was surprising to you?
Yeah, to comment. Well, first of all, I agree with Peter, and again, it was a really special team, and shows what we can do. It's again, unlimited potential that we need to keep that in mind for the future. So anytime, I remember all of it can't be done in a year, and it'll never be done, and it's going to take 5 years, and all of those things. But I think I agree with Peter. There was a sense of optimism even when we started. I think when we talk about speed, though, I do want to make a speed comment in terms of the perception all along is that we needed to develop these products in record time. But right from the beginning, it was always that these products would meet the highest standards of quality, of safety, and efficacy. And we preached it on day one, and I think we've been consistent all the way through. It's a testimony to the Food and Drug Administration and to Peter, and to saying that we can do both here. We can actually develop a product during a pandemic as rapidly as possible and not compromise. And not cut corner. We said we're not cutting corners, and I feel very strongly like we never did. And I feel that the transparency of the publications, in other words, okay, we have the results. They're going to go out in peer-reviewed journals. The transparency of the public review committees for both the FDA and the CDC. I'm very, very glad that we held that highest standard, as we learned in terms of the debates and the vaccine hesitancy and all the messaging around there. But it was never a question of, well, there's a point because, you went fast and so you lowered the standard, this, that. It didn't happen. And those standards are maintained, Peter. I mean, even to today, as we go into the next phase. And I guess I'm not surprised by that, but I'm really glad. I was very glad that was the message from the very beginning, and we have not wavered. I think the most disappointing thing, frankly, is the Delta variant. And I think what if you remember last spring, when the vaccines were really rolling out and we were getting to the point of a significant portion of adults being vaccinated. I was very hopeful. I was very hopeful that these vaccines would sort of maintain their high effectiveness, and that, I never thought that we would need such a high uptake to be able to kind of squash the pandemic. I was hopeful that we would, if you had 2/3 or let's say 75% of adults vaccinated, we'd be in really, really good shape. And I think Delta variant, as we debate, there's so much, this pandemic response has been so contentious in the United States. And I think one of the things that doesn't get mentioned a lot is that Delta variant is just the most awful, terrible, highly contagious, making people sick, affecting people who have been vaccinated. It's just been awful. It's just been a terrible, terrible variant that's created a terrible, additional wave, and it's not gone yet. So it's heartbreaking. The Delta variant is heartbreaking. What I do feel, frankly, very good about, though, is that we, again, as Americans, have responded to that challenge. And I think our government has responded. I think the FDA has responded. And I think America has responded, that we're vaccinating everybody that can get vaccinated. We're vaccinating with a third dose to protect especially the most vulnerable. We're not done. And the healthcare community has learned a lot about how to treat these patients and is learning every day and doing the best that we can. And we have a host of therapeutic options too. So, we're not giving up, but the Delta variant's been heartbreaking.
Yeah. Well, I want to start to close with a couple of questions individually for you, and then one last closing question for both of you. We're entering a period of time where in some cases we feel like the crisis is over, but your work actually continues. Peter, where do you draw strength in your work moving forward?
Yeah, we are still very much in the midst of this. And I think we can see that from where the pandemic is headed at the moment, but also because from the work perspective, there are a lot of vaccines and other medical products that we're going to need to be working on, and then cleaning up the backlog of what got put to the side while we were working on COVID. But I draw strength in the fact that we have an incredible team of people. This has been an opportunity to have people come together and work together towards common good. And I think, to the extent that we realize that we're all in this together, hopefully that will, if even one more person gets vaccinated because they realize that this is something we are all in together. Yes, there are probably very small risks with vaccination. That risk is minuscule compared to the potential benefit. And not just the benefit to you, and that's how we judge things at FDA, but there's this larger benefit to all of us. And so I think I feel good that I'm working with a group of people that we will get through this, and we're just going to do our best.
Well, we all hope so. Matt, before there were vaccines, a little over a year ago, you gave a TED Talk that said not only would the U.S. rebound, but we will take pandemics off the table. And now it's your day-to-day job to actually figure out how we do that. So not putting you on the spot in 30 seconds or less. Are you still feeling hopeful?
Yeah, absolutely. I think it doesn't, there's optimism, but it's also grounded in recognizing the enormity of the challenge. And why I'm hopeful is the technological advances during this pandemic have been astounding. Now, vaccines is a clear-cut example. There's many others. I'm very excited about telehealth. I'm very excited about opportunities to improve our healthcare system, to improve equity, that we've seen steps forward in this pandemic. And my sense is that our biggest challenge is not going to be the technology. If we just took a lot of that technology, applied it, scaled it, and made it happen, I think we could take pandemics off the table. I think the challenge is personal, and I think it's the ability to work together as teams and communities. It's the ability to really commit as a nation and in a global community that this is going to never happen again, to not forget, because there's a lot of tendency, like we just want to put this in the rearview mirror, and worry about other things. And there are other things to worry about, but we can't worry about this. But I think that the profoundly exciting part, though, is that if we can make billions of doses of vaccine, if we can distribute a healthcare system so that everybody truly their health is taken care of, we're not just going to take pandemics off the table. I mean, we can transform health and society in general.
That's right.
There's so much that's right there, you know, and we just got to work together as a team and do it.
Well, I know we've run out of time, but in one closing statement, on behalf of all public servants that you all represent, is there one thing you want to say to the American public?
Yeah, really quickly, just thank you for hanging in there. Get vaccinated, use precautions. We will get through this. And it's been a long slog, but we will get there together.
Thanks, Peter. Matt, final words?
And for all of that service and unselfishness that we see in the American people, that inspires us every day.
Thank you both on behalf of the Alliance, the American public, for all of your effort and all of the time that you've spent leading us through what has been a very challenging couple of years and leading us forward. So thank you very much.